in the first half of the show, we went through the A's, B's, the C's, and the D's of Medicare, and he brought up Medicare supplements or Medicare Advantage plans. So I think there's a question out there, kind of explain the pros of it. Do I need a Medicare supplement plan or Advantage plan?
Well, thank you very much, Chris. I think that's a great question to lead in this segment with. The question is, do I need anything else other than original Medicare? That's what you do when you come in to talk to us. We kind of look at your roadmap for healthcare. And do you need additional coverage? Do you want some additional things, dental, vision, hearing, over the counter, something like that? And when talking with our clients, we go down two paths: the Medicare Supplement path, or the Medigap path as it's called, or a Medicare Advantage plan. And we explain both of those in great detail. So the Medigap plans, what is one of the pros of that? It does have original Medicare as your primary. And then the Medigap, as its name suggests, just picks up the gap in where Medicare doesn't pay. And like the Medicare alphabet soup, Medigaps do have a letter with them as well. So we go down the Medigap plan, and that's going to be covering, like I said, the gaps that Medicare doesn't cover. And what is the advantage of doing a Medigap plan? It is going to be freedom from a network. It's going to be kind of go wherever you want to go, whenever you want to go, without asking, Mother, may I? So it is anybody in the country that accepts Medicare will accept the Medigap plan. So that's one of the benefits of that. Another benefit is very low or predictable costs. So some of the popular plans that we have here are Plan G and Plan N. So Plan G and Plan N, they're going to cover inpatient hospital at 100% coverage. Any hospital that you go in that does accept original Medicare is going to take that Medigap plan. On the physician side, you're going to have a Part B deductible that you're going to have to pay on Medigap G. After that, you have no additional out-of-pocket costs. Plan N, you'll pay that same Part B deductible plus a copay when you go see the doctor, physical therapy, a blood draw, something like that. But with those plans, you have a very predictable monthly expenditure, anywhere between, $100, and it ranges based on your age, your gender, and where you live. So those are some of the pros of a Medigap plan. Some of the cons, what it sounds too good to be true. What are some of the cons? You have a very predictable monthly expenditure. That was a pro that I just mentioned ago. However, if you're somebody who is pretty healthy and doesn't use the health insurance benefits, you're spending money you don't have to every month. Whether you use it or lose, or whether you use it or not, you're spending that monthly premium. And like I said, those premiums are based on age, they're based on gender, based on location, and those premiums do go up every year. Death taxes and Medigap premiums will go up every year. Some of the other cons, the upfront costs, like I just said, you're paying those monthly premiums. It does not come with a drug plan. And in one of the previous segments, we talked about that Part D plan where you do have to have a drug plan, even if you don't take prescription drugs. So what we do here is we go down that Medigap path. And then if you say, okay, now I need to talk about my medications, you then have to purchase a standalone drug plan to make sure that you're compliant and to avoid any penalties with original Medicare. In doing that, Scott mentioned in one of the other segments that there are plans out there that do not have a monthly insurance premium for the standalone drug plan. Great for somebody who's not taking prescription drugs or taking your tier 1 or tier 2 drugs. So those are some of the different things that we talk about on Medigaps, the pros, the cons. Conversely, we then enter the conversation about Medicare Advantage plans. So that's the kind of the all-in-one combo plan. That's going to take the place of Medicare Part A, Part B, and Part D, and that's now called Part C. So the alphabet soup continues. You have a one-stop shop for all of your healthcare needs, and those plans typically will come with a $0 premium. They will typically come with your dental, your vision, your hearing, your over-the-counter, your prescription drugs, your silver sneakers benefit, some kind of transportation benefit in some cases, and all for a zero or low monthly premium. The pros to that, obviously, no monthly premium or very low. Those are the pay-as-you-go plans. So if you go to your primary care physician, most of the time those visits are going to be covered at a $0 copay. The specialists are going to range anywhere between $20 and $40 depending on the plan. So you've got very predictable costs. Like I said, you do have the additional benefits that is offered in those plans. And again, you do have a safety net, unlike original Medicare. You have an out-of-pocket maximum that caps your medical expenses in any given year. The most you can spend on medical expenses will be capped, and you'll know that based on the plan designs that we decide. Some of the cons. The Medigap plan, I said complete freedom. You can go to any hospital, any doctor. The Medicare Advantage plans, you're going to have a network of hospitals and doctors that you'll need to stay in order to receive care. Obviously, emergency and urgent care are covered anywhere in the country. No network needed, no calls, no referrals. You just go. The out-of-pocket costs, they could add up for somebody who is enrolled in a PPO Medicare Advantage plan and seeking out-of-network benefits. Those premium, or I'm sorry, that co-insurance or those copays could add up for somebody using the benefits a lot. There are some plans out there that will require prior authorizations for different services, like a surgery. You're going to have to make sure that the surgery is going to be prior authorized by the plan. Your doctor's office can take care of that as well, and just to make sure that you remain compliant and the benefits are taken care of for you. The coverage and the rules with each individual Medicare plan, those can change annually. So that's something that we do for our clients. We bring our clients in individually, and we talk with them and as a group, going over the annual notice of change that these plans will send out to you. We'll see the pros, the cons, what the plan did to change this year or next year versus this year. So those are the kind of the avenues that we discuss when we're going down the road to Medicare, whether it's the Medicare Supplement or Medigap or the Medicare Advantage Plan.
Dan, do you see a price difference for male versus female on the Medicare Supplement or Medigap plans?
Now, depending on the carrier that you choose, there can definitely be a gender rating difference.
Perfect. Yeah. So we here at AMA, we offer all plans, all options for you. If you feel that a Medigap or Medicare Supplement plan is best for you, fits your needs better than the Medicare Advantage plans, we're here to help you understand exactly how all of these plans work, make sure that it's best going to fit your needs moving forward. That increased premium on an annual basis for the Medigap plan, there comes a point in time where you get to where the cost that you're paying per month equals the out-of-pocket exposure on the Advantage plan. So one of the things I know that Dan and Troy do very, very well is they go through all of that with their clients, and they come up with a game plan that's best going to fit your needs. So, depending on what plan is best for you, it really doesn't matter to us. It's always what's in your best interest, and we're here to make sure that you make a good, educated decision and cover all of the needs that you're going to have moving through retirement and on to Medicare. And we want to make sure that we don't bankrupt your retirement by putting you on a plan that's not best for you, and you're going to have some major out-of-pocket costs.
So if you were looking for an easy answer between what's better between a Medicare supplement plan or a Medicare Advantage plan, you should know better by now. It's not a one-size-fits-all situation. But the team at America's Medicare Associates can help you run the numbers and show you, and at the end of the day, let you make an informed decision about what's going to work best for you. All you have to do is reach out, set up a time to speak with them. 419-794-3030. That's 419-794-3030, or you can go to the website and set up a time there as well. That's, of course, arhq.com.